Oprah, Bill Clinton, Gerald Ford, Benjamin Franklin, Tyler Perry. What do all these people have in common? They've all been through great trauma, great adversity in their early childhood. We know them as famous people who have recovered from difficult things, but just as much we know them as people who have lifted themselves up by the bootstrap. So the bootstrap myth, what is it? What does it mean to us? What does it mean to us today? Literally, it means lifting oneself off the ground by one's bootstraps. It's an imagined feat. This metaphor forever meant something that couldn't be done. But today, in American ethos, it means something very different. It means something new. It means lifting oneself out of a difficult situation using only one's own resources, with no one else's help. So, I thought I'd test it out. I think the myth won out. Gravity kind of kept me on the floor. No matter how hard I pulled, I stayed there. But where does this come from? Where does this belief system come from? Why do we believe this? Well, it's believed that where this came from primarily, its origins, comes from the fantastical stories of Baron von Munchausen. He was a famous adventurer who, amongst many crazy things, as you can see, rode a cannonball, and is well known for having lifted himself and his horse out of a swamp by his own bootstraps. So this is where the language comes from. You can see that this is almost comic-like, this image and where the term comes from. But where does the philosophy come from? Well, we know the philosophy comes from colonial America. It is based in Puritan belief. The Puritans led the famous German economist, Max Weber, to come up with the phrase, the Protestant work ethic. And basically, this concept told us back then that hard work, was at the heart of success. So for the individual, it was critical. For the community, it was critical. But for them, it actually led to salvation in the eyes of God. But what started to happen as we approached the 20th century is we began to see a change in the thinking of the bootstrap myth. And men such as Rockefeller and Ford and Carnegie began to change the way we see this term. The self-made man became a critical part of the American belief system. They exemplified the idea that if you work hard, if you do what you need to do, you will make it. You will make it to be just like these guys. That was truly the belief at the time. And, we all know, continues to today. If you do a Google search, you're going to find some interesting things. The use of the term by the bootstrap. By the bootstrap was hardly ever seen in literature, in American literature, until the early 1900s. You see after 1920 an explosion of the use of the term, and again after the 70s and 80s. And when's the last time you heard a politician doing a campaign speech where they didn't talk about their humble beginnings? Where they didn't tell you about the tough times that they had, where they came from nothing, how they made it. It is the story we tell over and over and over and over again. It's how we begin to define success. There is a challenge and a risk in this, and it's very important for us to understand this risk. We now believe that the way you make it, the way you get through adversity, the way you get through trauma, the way you get through poverty, whatever it is we want to speak about today, is through your own grit, your own hard work, your own effort. So therefore, where does that go to those who don't make it? What do we as a society then interpret about those who don't make it? We blame them for their position. And when we blame people for why they're in the situation they're in, it takes away responsibility from the rest of us to do anything about it because it's their problem. And that's the risk that we sit in today. So, the Pew study of economic mobility in 2009 questioned Americans about their belief systems, the things that they believe in. 40% of Americans surveyed said that it was common through hard work for a person to go from being poor to make it rich. Hear that again. In 2009, 40% of Americans believed that was common. 71% of Americans believe that it's the attributes of hard work and drive, not life circumstances, that are why people succeed. Now, the bootstrap myth just keeps, this belief that we have about this just keeps driving and driving us kind of in the wrong direction. So if we think of a ladder that's like almost impossible to climb up, right? Pew, in the same study, found that it's rare for a person in the United States to go from being poor to rich. And it's even uncommon for a person to make modest gains on the economic ladder. So why do we continue, despite the facts saying one thing, to believe something else? Why does this keep happening to us? What might really be the factors? I'm going to give you one example today, but there are others. But I'm going to give you one example today, and we're going to talk about the ACEs. These are adverse childhood experiences that impact on children so profoundly that they affect their adult outcomes for decades. This was a study done through the CDC and Kaiser Permanente. 17,000 middle-class people participated, insurance-carrying individuals. And it found that the early childhood trauma led to chronic diseases, depression, exposure to violence, committing violence, and many, many other things. So these 10 items that they used in the original survey, and I should say there have been others done after this, there have been hundreds of studies done since then, and they're all pretty much finding the same results. But these were the things that they looked at, and there are 10 of them, everything from physical abuse, domestic violence, sexual abuse, separation of parents. If you had one of these, if you checked off one of these, you got 1 point. There are 10, so each person can get a score of 0 to 10, right? So they're highly prevalent. What's really important to note here is 64.7 of the 17,000 people that were surveyed had at least one. So these are highly common. And all of these things that you see up here right now were found to correlate with that adversity, those 10 adverse experiences. All of these things. Sure, you're not surprised to see up there things such as substance abuse, alcoholism, etc. But what should surprise you a little bit is a direct correlation with stroke rates, heart disease, cancer rates. Now, it's also important to note that how much of this happens has a direct impact on the consequences as well. So, if you have 4 ACEs or more, you are twice as likely to be a smoker, 7 times as likely to suffer from alcoholism. If you have 4 ACEs or more, you are 4 times more likely to have chronic bronchitis. You are 12 times more likely to commit suicide. If you have 6 ACEs or more, you're at high risk of reducing your lifespan by 20 years. So, we see all this adversity on one side of this scale, right? We see it's weighing down the scale on one side, but all of us in here know that there are people that you know, people who have somehow weighed the scale in the other direction. And what is that about? Well, there's been a great deal of research about the kinds of things, these common factors that impact on the likelihood that a person is going to be able to survive and succeed despite adversity. And these are called protective factors. And there are many of these, but there are really some that really are highlighted and are the ones that we mostly talk about. But these protective factors, if in place, increase the likelihood that a person will be successful despite the adversity that they're experiencing. So, the first and most important one, it's number 1 on the list, is a child having a stable, loving, caring, supportive adult relationship amongst their important adult relationships in their lives. At least one important relationship that's highly successful in this way. I did not qualify that as a parent, realize. It's an important adult relationship that's highly successful. This is the most significant one of all and the most important of all the protective factors. Children need to learn how to cope with threats to their social and physical environment. They also need to learn to gain a sense of mastery over their life. I think you're not surprised that a child or an adult that child grows into, if they believe that they're going to be successful, the odds are that they're going to probably be more successful. If they believe they'll get through something, they're more likely to. So there's a dose of adversity that all of us should experience as young kids that's kind of a healthy dose. It kind of gets us to that place. And then when you start experiencing more than that, we obviously go to very negative places. But things like losing a Little League game, getting a bad grade on a test, these are all things that help kids learn how to deal with adversity. Learning. Kids need to learn. The cognitive ability, kids' ability to self-regulate, it's critical. For children who have these skills, who are able to learn, who have positive experiences in learning, are more successful than those who do not in dealing with adversity. Children cannot learn if they're experiencing adversity early in life. And the importance of traditions associated with culture and with faith. Children who grow in that sense, that context of being around a sense of who they are, belonging to something, being part of something, those kids tend to be more successful, more resilient than otherwise. So now we gain a different picture, right? We see protective factors, and now we see protective factors outweighing adversity. But what's important about thinking about this, and I'm going to pull us back to the Bootstrap Myth for a moment, is the Bootstrap Myth has us think in terms, for example, of, let's pick the safety net. We think a lot about the safety net in our society. In other words, when someone's in trouble, they're having difficulty, we lend them a helping hand, and then they'll take it from there. They'll lift themselves up after we give them that lending hand during a difficult time. Why don't we think about this a little differently? Why don't we think about it as a foundation, built on pillars based on the protective factors? What if, as a society, instead of waiting till someone is having a problem, we built into our society protective factors, a foundation that we all live on top of? And therefore, we value these concepts of what helps people be successful in life. What do we already know through science helps kids get through difficult things, and later on helps adults get through those difficult things? So a couple years ago, I was at a conference in New York and saw a presentation by a hunger organization. And this hunger organization spoke to their food pantry. They noticed that a majority of their people were eating a smaller amount of the food in their pantry, and a minority of the folks that were coming in were eating a disproportionate amount, high amount of that food. So as they went through and looked at it, they had these anecdotal ideas of what might be going on, but then they realized that there was something deeper. So they coincidentally had gone through the ACEs study recently and realized, why don't we do the ACEs survey for all of these folks? Lo and behold, what did they find? There was a direct correlation between how much food people were picking up and what their ACEs scores were. And the light bulb that went off for these folks was that hunger and food was not the issue. That was a symptom. The issue were the other adversities that they were experiencing. So then they turned around and they built an entire net of services around their food pantry to support people and link them to the other kinds of services that were actually going to begin to change their life circumstances. Imagine thinking of a school system, of our education system in a new way. Imagine of thinking of building not just grades and benchmarks for grades, such for math and English and so on, but imagine benchmarks around a protective system for the child. Imagine if every decision, every time we're looking at a child, we had to think about, are these protective factors in that child's life? And we involve parents and neighbors, teachers, counselors, lunch ladies, janitors, nurses, everybody in that child's life is involved in trying to determine, are these protective factors there, and how do we build those for that child in their life? Imagine if we were benchmarking classrooms, schools, school districts, and not just doing testing around English and math. And imagine city planning. City planning today is based on a couple things. City planning tends to be, you look at areas that are having difficulty, and how do we develop it economically, and how do you get services to that particular area? Well, what happens today is we go in, we develop this area, that area begins to improve economically, housing costs go up, the people who currently live there have to move out to another neighborhood because they no longer can afford that neighborhood. They move to a neighborhood they can afford, which means there are no services there, and there's no public transportation, health care, education, all those services start to diminish. So what do we end up doing? Are we developing communities, or are we developing geographic areas in the current model? And what I would ask you is that we rethink this and say we look at the people who live in that community, and how do we build foundations in communities based on these protective factors that allow the people who live there to begin to be successful where they live. and not have to move out and go somewhere else. It's a different way of thinking about city planning. And we do this in every single neighborhood in the city. So, in conclusion, a couple things. We've heard today that there's science behind the concept of protective factors and adversity, right? We understand bad things happen, there's negative consequences, and then if you build this foundation in place, people do better. This is something we know already. So the bootstrap myth seems to outweigh it somehow. This belief that people earned their position seems to outweigh it. It gives us the freedom to blame them and gives us the freedom to not take responsibility for fixing what's going on in our system. Why is it if we see a 90-year-old man who's been smoking for 70 years and never got cancer, we don't say, well, he did it, why can't the rest of you? We do all accept that smoking causes cancer, but we also understand there are exceptions. There are exceptions for a lot of reasons. So why is it that when we're talking about this sort of thing, they're not exceptions? We have turned exceptional into common. That person that does something exceptional is now, well, he did it, so why can't the rest of you do it? He's exceptional. It's okay. So all this leads me to saying, please, don't let the truth get in the way of the facts. Thank you very much.